Now coming to the next anesthesia, which is called as epidural anesthesia. Next anesthesia called as what, guys? Epidural anesthesia. Right? We are talking about this anesthesia technique called as epidural. First, guys, starting with what? Indication of epidural. For what surgery is epidural anesthesia indicated? Come on, guys, for what surgeries will you go for epidural anesthesia? Epidural anesthesia is indicated for one indication we have already discussed. It is indicated for below umbilicus long duration surgeries. It is indicated for below umbilicus long duration surgery. Below umbilicus long duration surgery. Below umbilicus long duration surgery, you can go for epidural. And you guys know the reason very much, yes or no? Why epidural gives you a long lasting effect? Why? Because in epidural anesthesia, we kept an epidural catheter. In epidural anesthesia, we have kept an epidural catheter, right? So that's why through that catheter, we can give the top-up doses. That's why epidural acts for a longer duration. So the main indication for epidural is what, guys? Below umbilicus, longer duration surgery, you can go for epidural. Second indication for epidural is what? Epidural anesthesia can be used for painless labor. Epidural anesthesia can be used for what, guys? Painless labor. Painless labor. Now, what is this painless labor? What is the meaning of painless labor? Painless labor means normal vaginal delivery without pain. Is it possible, guys? Is it possible for a lady to have a normal vaginal delivery without pain? Nearly impossible, yes or no? Why? Because in normal vaginal delivery, why is the patient having pain? In normal vaginal delivery, why the patient have pain? Why? Because the patient is having contractions. If there is contractions, there will be pain. If there is contraction, there will be pain. Yes or no? Right. Painless labor meaning what? Patient delivering the baby through normal vaginal route without pain. Highly impossible, but thanks to epidural, it is made possible. Thanks to epidural, it is made possible. So guys, basically you will be getting a call from the hospital saying what? Saying that a patient is there who is in labor, she is having extreme labor pain. Please put an epidural catheter and give her epidural anesthesia. You put an epidural catheter, you give the drug. Remember, the most commonly used epidural, the most commonly used local anesthetic for epidural is same like spinal, it is bupivacaine. For labor analgesia also you use bupivacaine. But the question is not about this. The question is about what? What dose of bupivacaine are you giving to the patient? What dose of bupivacaine will you give to the patient? Will you give in a high dose or a low dose? Always remember, guys, always remember, whenever you are giving an epidural anesthesia for painless labor, you have to give the drug in low dose and low concentration. In low dose and low concentration. If you give the drug in low dose and low concentration, it will only cause sensory block, while the motor activity is intact. While the motor activity is intact, right? As you have given the epidural anesthesia for painless labor, it will only cause what block, guys? You remember, always give the drug in what dose and what concentration? Low dose and low concentration. If you give the drug in low dose, low concentration, it will only cause sensory block. It will only cause sensory block, right? Motor activity will be intact. Yani ke contractions will be intact, but the patient won't have the pain of contraction. The sensory activity is gone. But if you give in a low dose, but if you give the patient epidural anesthesia in a high dose, high concentration, then what will happen? Sensory, motor, both are gone. Patient will tell, doctor, I am not having pain. At the same time, she is also not having the contractions. Will she deliver through the normal vaginal route? Not at all possible. What do you have to go? You have to post the patient for cesarean section. So remember guys, epidural anesthesia can be used for painless labor. The third indication for epidural anesthesia is what? First indication was below umbilicus long duration. Second is painless labor. The third indication for epidural anesthesia is what, guys? The third indication for epidural anesthesia is it can be used for post-op pain relief. It can be used for what, guys? Post-op pain relief. If the patient is complaining of pain in the post-operative period, you can go for epidural anesthesia. Post-op pain relief purpose, you can use what, guys? Epidural anesthesia. Imagine a patient is posted for open heart surgery. Patient is posted for open heart surgery. For open heart surgery, it is a major surgery. For any major surgery, what anesthesia will be required, guys? For any major surgery, you require to give the patient what anesthesia? You require to give the patient general anesthesia. But after giving general anesthesia, the surgery will be done. So guys, I was talking about open heart surgery. What is this open heart surgery about? Open heart surgery literally means open heart. You cut open the chest of the patient. You see the heart. You see the arteries which are blocked. Normally open heart surgery is usually recommended for triple vessel disease and all. You cut open the chest of the patient. You see the heart. The 3 arteries are blocked. What do? You create a bypass. After creating a bypass, the surgeon basically you means the surgeon will be doing all the things. After creating a bypass and all, after the surgery is done, the surgeon first, before open heart means before going towards the surgery, he first opens the chest by cutting the sternum and breaking the ribs. He will open the chest and he will what he'll do, that is called a sternotomy. Then he'll fix the heart. Then what he'll do, then he'll approximate all the ribs towards the sternum and sew the ribs, right? Now guys, look over here. This patient after surgery is shifted to the post-op room. This poor patient in the post-op room, the main and the only complaint will be what? Dr. Saab, I am having severe pain over here. Over this part, I am having severe pain. When the patient is complaining of severe pain on that part, what will you do? You have to give some pain relieving medications to the patient. Why? Because if you don't give pain relieving medication, he'll have tachycardia due to pain. That will increase the load on the heart. So what we need to do, guys? Can we give painkillers? Can we give the conventional painkillers and all? Can we give the NSAIDs? We can't give NSAIDs and conventional painkillers to the patient. Why? Why? Because the patient has undergone what surgery? Open heart surgery. The heart is the big boss of the body. It is healing. Give the time to the big boss. Don't give some conventional medications like NSAIDs or anything. What will happen? If the big boss is not working properly, there will be hypoperfusion to other organs. If you give NSAIDs at that time, if you give painkillers at that time, there will be much chances that you might damage the kidney, patient might develop renal failure. So how will you release the pain? How will you relieve the pain, guys? How will you relieve the pain? For relieving the pain, we can place epidural. But now you might be a bit confused. How epidural, sir? The patient is having pain on this part. My epidural is working for below umbilicus. Then how will my epidural work over here? Remember guys, for post-op pain relief, we can place epidural depending upon what purpose is it used for. I gave you an example of open heart surgery, means patient is having pain over here, so you can place epidural at the cervical or the thoracic intervertebral space. Cervical or thoracic intervertebral space. Now you might be getting a doubt, sir, their spinal cord is there, no? Will there be any damage? Guys, we are talking about epidural. Epidural means outside the dura. It has nothing to do with the spinal cord. So remember guys, for post-op pain relief purpose, we can place a cervical or thoracic epidural also, right? So there are 3 indications for epidural, guys. One indication is below umbilicus long duration surgery. Second is for painless labor. Third indication is for post-op pain relief. For post-op pain relief. So guys, we were talking about what? We were talking about the position, right? So same like we are just starting with what? We are now starting with the procedure of epidural. We know the indications of epidural. We need to know the positions for epidural anesthesia. Okay. So look over here, guys. Position. Whether it is spinal or epidural, both are usually given in the position called as lateral or sitting position. Again, there is nothing like which is common and which is not common. You can go for lateral or sitting position. That's the position. After position is what? It's the site for epidural. What's the next thing? Site. Site. Site totally depends on the purpose. The site of epidural depends on the purpose. The site depends on the purpose of epidural to be used. Purpose of epidural to be used. Its site depends on the purpose of the epidural to be used. If it is for below umbilicus long duration, as I already told you, below umbilicus long duration, or if it is for the painless labor, then you go for the same site like spinal. It is L3 to L5. L3 to L5. Once again, how will you identify the L3, L5 space? It's very simple, guys. With the help of what line? Diffuse line. With the help of diffuse line. Okay. Keep the both hands on the highest point of the iliac crust. Thumbs like this. An imaginary line can be drawn between your thumbs. That indicates the diffuse line. That indicates the L3 to L5 space. Most commonly indicating the L4, L5 space. So remember, guys, for painless labor or for below umbilicus long duration surgery, you place epidural at L3 to L5 space. Whereas if epidural is placed for post-op pain relief, for post-op pain relief, you can place epidural at the what level? At the cervical or thoracic segment. Cervical or thoracic intervertebral space. For post-op pain relief, you can place cervical or thoracic epidural, right? After knowing the site, next is what, guys? Clean the site. After you know the site, next you have to clean the site. Same like spinal, guys. How will you clean the site? First, sir, I will apply betadine, which is a red color solution. Then apply surgical spirit. Then apply what, guys? Surgical spirit. And then you apply dry cotton. First we apply betadine, which is a red color solution. Then we apply surgical spirit. And then we apply dry cotton. Once the area is totally ready, then you have to insert the needle. So what needle will you use in epidural anesthesia? Will you use a dura cutting or will you use a dura separating? Your answer to me should be what? Sir, neither I use dura cutting nor I use dura separating. Why? Because what anesthesia are we talking about? We are talking about epidural. Means outside the dura, nothing to do with the dura. The needle that we use in epidural anesthesia is a special needle called as Tuhois epidural needle. Called as Tuhois epidural needle. This Tuhois epidural needle size is 18 gauge. This is a thick needle. This is a thick bore needle. Why it is a thick bore needle, guys? There are two reasons. The first reason why it is a thick bore, why? Because through this needle you have to place a catheter. Second reason, we are not damaging the dura, so there is no chance of PDPH. Thin bore dura separating is used in spinal. Why? Because in spinal you damage the dura. In epidural there is no dural damage, hence you use a thick bore Tuhois needle, right? Tuhois epidural needle, which is a thick bore needle. By looking at this needle, you can say it is a special Tuhois needle. On this needle, remember guys, by looking at this needle, you can say it. On this needle, we have 1 centimeter of light and dark bands. On this needle we have alternating 1 centimeter of light and dark bands. Alternating 1 centimeter of light and dark bands are there on this needle, right? This is a 18 gauge needle, which is, what is the length of this needle, guys? The length of the needle is 9 to 10 centimeters. 9 to 10 centimeters, right? This is regarding the epidural needle. So, as you pass the needle from the skin, what are the layers which are pierced, right? What are the layers which are pierced? These 2 points are very important, guys, regarding needle. The layers pierced by your needle are, the first layer is what? The first layer, same like spinal, it is skin. After skin, it is subcutaneous tissue. After subcutaneous tissue, it is supraspinous ligament. Supraspinous ligament. After supraspinous ligament, it is interspinous ligament. After interspinous ligament, it is what, guys? Come on, after interspinous ligament is what? Ligamentum flavum. Ligamentum flavum. Once again, ligamentum flavum, always remember an MCQ point over here. What is the toughest ligament in overall category? The hardest or the toughest ligament remains ligamentum flavum. The next thing that we need to remember, how will you identify the ligamentum flavum is pierced? It can be identified by 2 things. On piercing of ligamentum flavum, a snap or sudden loss of resistance is felt. Sudden loss of resistance is felt. Now, after passing ligamentum flavum, what is the next layer? Next layer is dura. But will you puncture the dura? Will you puncture the dura, guys? No. You won't puncture the dura. The last layer to be pierced, again in MCQ, the last layer to be pierced in epidural is what? The ligamentum flavum. Once you puncture the ligamentum flavum, stop there. Once you feel loss of resistance or snap, stop there. Remove the guide wire. What is an epidural space? Epidural space is the space between ligamentum flavum and dura. Ligamentum flavum and dura, that is the epidural space, right? Once we are in the epidural space, what we need to do, guys? Once we are in the epidural space, we place a catheter. We place a catheter. Right? We place a epidural catheter. And through this catheter, we give the drug. And via this catheter, through this catheter, we give the drug. We give the drug. Right? So remember, this is the process of epidural. For painless labor, you have to give the drug in what dose? For painless labor, we give the drug in low dose and low concentration. Low dose and low concentration, which will cause only sensory block, which causes only sensory block, while motor activity is intact. While motor activity is intact. Right, guys? This is regarding your spinal and epidural anesthesia. Okay, guys? Okay, thank you.